Hello, my name is Doug Waite. I am Covenant's Senior Vice President and Chief Medical Officer. I am also a board-certified infectious disease physician, and as such, I am leading the efforts to prepare Covenant Health for the likely encounter of a potential suspected case of the novel coronavirus. So this video is presented to provide Covenant Health with a brief synopsis of the latest information on the novel coronavirus outbreak. The intended audience is essentially Covenant providers. However, other folks and other staff within Covenant Health may also find it useful. Now, it should be noted that this video is being recorded on Monday, February 10th, and because this is a very rapidly evolving situation with a lot of changing numbers and more that is learned about the virus as time goes on, it's likely we'll have to provide some updates over the next coming days and weeks. I would encourage you to frequently visit the CDC's website, cdc.gov, for the latest information and all the rest of the information you may need to know and questions you may have. It's updated quite frequently and a rich source of information. First of all, I'm going to tell you a little bit more about the virus, where it came from, more about the epidemiology and the current numbers, limited information on the clinical syndrome, and then what we need to do to be prepared and our response should we see a potential case. Chinese authorities first reported an outbreak in a cluster of respiratory illnesses on December 30th, centered around a seafood and live animal market in downtown Wuhan, China, and Hubei province. Since then, it's rapidly spread throughout that province. Human-to-human transmission has been well documented and is occurring in a very robust fashion, and it has spread to 28 countries with confirmed cases. However, the vast majority of cases and deaths still remain within China to this day. What are coronaviruses? Well, coronaviruses actually, four of the 7 strains that have been found in humans are some of the most common causes of runny noses and sore throat, i.e. the common cold. However, many more coronaviruses exist in many different species of animals. The current novel coronavirus is a beta coronavirus, which is similar to the viruses that were discovered as causing SARS in 2002 and 2003, and more recently MERS in 2012. When you look at the genetics of this new virus, it is similar to strains of a bat coronavirus, similar to SARS and MERS. And when you look at the different genetic makeup of the strains that have been cultured from patients in this outbreak, the genetics are well preserved, so therefore it's evidence of a single species spillover event likely in that market in Wuhan. The current numbers now, as of today, there are 40,000 cases globally, again, vast majority in China, and over 900 deaths. In the United States so far, there have been 12 cases confirmed, no deaths, but there are persons of interest, persons under investigation in 37 states. Now, if you contrast that to this year's experience with the seasonal influenza, so far this year, in the U.S. only, there have been over 12 million cases of documented influenza, with close to 12,000 deaths, much more of an impact. And I'll tell you, it's not too late to get the flu vaccine at this point in time, and please make sure you're telling your patients to do that, because that's the best way to protect you from infection from a far more common virus out there. The reproduction rate of this virus is felt to be, in the preliminary calculations, to be about 2.6. That means every one case of human coronavirus is likely to infect about 2.6 other patients around them. Now, how does this compare to other viruses? In influenza, most seasonal influenza strains each year, the reproductive rate is around 1.3, so this coronavirus is twice as contagious as influenza. When we've had pandemic strains of flu, it's been up to 1.8, which has been quite bad, but this coronavirus obviously is higher than that as well, too. People are talking about the word pandemic. At this point, that's not a word that global health authorities are using. However, it should be noted that this is a brand new virus. The human experience is not good with this virus yet, and therefore the human population is not immune to this. So should it get into countries where there is a lack of public health infrastructure, it could spread very quickly, and then maybe the term pandemic might be used at that point in time. People ask about its virulence, and the case fatality rate so far, again with limited numbers coming out of China and rough preliminary calculations, is around 2.2%. Now, how does that compare to influenza? Most seasonal influenza years, the case fatality rate is about 0.05%. So this is probably 40 to 50 times more virulent than seasonal influenza. On the other hand, our experience with SARS was that its case fatality rate was 10% and MERS over 30%. So this doesn't appear to be as virulent as the other coronaviruses that have caused severe illnesses in humans. The survivability outside the human body, anywhere from a few hours to 1 to 2 days maximum, depending on the surface that the virus touches. Not quite as bad as norovirus, but it can survive outside the body. The virus can survive in respiratory droplets in the air for a good 10 minutes or so. The clinical syndrome, we really don't know the full spectrum of the clinical syndrome right now. There's been very little reports so far in the literature, but so far what we know is that it causes a wide diversity of illnesses, from mild to moderate to severe disease and even death. Question if it can cause an asymptomatic infection. There's been a case report possibly of a child or two that may have had an asymptomatic seroconversion. Not quite clear yet on that one. It is clear, however, that children are much less susceptible to infection with this virus. Risk factors for more severe disease include advanced age, underlying medical conditions such as diabetes, hypertension, and coronary disease, and extrapolation to likely lung disease, kidney disease, and liver disease as well, too. The average age of deaths in the first cohort reported in China was around age 59. The incubation phase of this virus is 2 to 14 days. No coronaviruses in humans have found to have an incubation phase longer than 14 days. Symptoms consist mainly of lower respiratory tract symptoms like cough and shortness of breath, occasional sputum production, but far less in the way of upper respiratory tract symptoms, much less in the way of runny nose, sore throat, etc. Chest x-rays can be normal. When they do become abnormal, it usually occurs several days into the illness, usually between day 7 and 10 in the U.S. experience so far. Fevers can last for several days and can be quite undulating and unpredictable. The first cohort studied in China was a very, very sick group of coronavirus patients. They were all hospitalized. 100% of them had abnormal chest x-rays ranging from bilateral fluffy infiltrates to patchy infiltrates to full-blown ARDS, kind of a classic viral pneumonitis appearance. Case fatality rate in this group was 11 to 15%. Labs showed lymphopenia, elevated liver tests, and the occasional acute kidney injury and myocardial infarction. Those who died had respiratory failure, shock, and some vascular collapse. They have found quite a bit of cytokine production in this, almost a cytokine storm, similar to what we see with viral hemorrhagic fevers like dengue, Ebola, and hantavirus pulmonary syndrome. Viral RNA can be found in sputum, nasal swabs, blood, and feces. Treatment, it's just supportive at this point. There's no meds found to actually help this. And prevention, we'll talk about that in a minute. Use of good public health strategies and social distancing. But a vaccine, several companies are working on a vaccine right now. The anticipated time to get a vaccine, a candidate vaccine for testing in humans, is around 3 to 4 months, which is remarkably shorter than the 20 months 17 years ago with the SARS outbreak. So what has the responses been, and what should we do now? First of all, the responses have been global and unprecedented. In China, for example, most of the Hubei province is under a strict quarantine enforced by government officials. That's about over 54 million people told to stay home, whether you're sick or not. Businesses are closed, the economy's been impacted, even Disney in China has been closed. On January 30th, the WHO declared this a global public health threat, which enacted a variety of other interventions that could occur. And in the US a day later, this was declared a national public health threat, which in our country activates certain laws and powers. So for example, as of February 2nd, 5 p.m., the following laws are enacted as a result of this presidential declaration. Number one, any non-US citizens who are coming to this country from China will not be allowed entry. Number two, if you are a US citizen and you've been traveling from Hubei province, you'll be stopped at one of 11 airports around the country, and you will be mandatorily quarantined for 2 weeks in a refurbished military facility that the government has set up for these individuals. Number 3, if you're a U.S. citizen, you're traveling from elsewhere in China, and you have no symptoms, you are to self-quarantine yourself in your own home, watching for symptoms, and to contact your provider or the public health authorities if you get symptoms. So for us, here at Covenant, what does this mean that we should do? First of all, number 1, we're going to follow the CDC's recommendations. There's no sense to reinvent the wheel. We have some excellent global experts in public health at the CDC, and they're crafting recommendations as we speak. Number 2, we should be screening our patients that come to seek care from us at the earliest point of contact possible. That could include in-person or telephone screening. And this includes asking 2 very important questions, and this is summarized in coronavirus screening guidelines that we released last week that should be being circulated now to those who need to ask these questions. First of all, do you have any chance of being exposed to someone with coronavirus? That is, have you traveled to China within the last 14 days? Or have you been in contact with someone who is known to have coronavirus or who is under suspicion for coronavirus? If the answer to either one of those questions is yes, and the patient has no symptoms, what you should do is call your local infection preventionist immediately, or if it's after hours, the nursing supervisor. They will notify your local and state departments of health. The second question is, do you have any symptoms currently? And specifically, the CDC is asking us to ask, do you have fever, shortness of breath, or a cough? If the answer is yes to the first question and yes to the second question, i.e. symptoms, first of all, you should hand a mask to the patient and have them place it on them. Masking is much more effective if it's placed on the patient with the illness than on those exposed to them. Masking should be used for us healthcare workers as well. Next, the patient should be moved to a private room. If an airborne isolation room is available, that should be used. And then number 3, contact precautions should be implemented, including all the usual personal protective equipment. Airborne isolation should be used, along with droplet precautions using a face shield to prevent droplets from contacting your nasal and eye mucosas. Then right away after that's done, you should call your local infection preventionist, who again will contact your local departments of health. If there's a telephone encounter when a patient calls saying, I just got back from China, or I've been in contact with someone who had the coronavirus, those questions should be asked as far as the symptoms go. And if they're positive, that patient should be referred to the closest ER. And then you should actually pick up the phone and call that emergency room saying, hey, I just took this telephone screen. This is a potential case that needs to be investigated, and you should be getting ready for this patient's arrival. The third part of this is document your findings, your answers to these questions about travel, contact, and symptoms in the travel screening section of our version of Epic CareLink. So in summary, this is a novel coronavirus. It appears to be spread very, very easily, more readily from human to human than the influenza. It has a case fatality rate that is alarmingly high, not as bad as other coronaviruses, but definitely worse than influenza. It's likely going to spread more before this is done. For us, we need to follow the CDC's recommendations, implement those travel screening guidelines at the first point of contact, as mentioned, and then document the answers to those questions in the travel screen section of CareLink. I want to thank you for your attention here today. I refer you again to cdc.gov for further information on this novel coronavirus. The coronavirus page is at the very top heading of their homepage, and we'll be providing updates later on if needed as this outbreak unfolds. Thank you for your time.